gurney, there's an oxygen tank underneath here. So if you want to come around, you could always check if it's full or not. It'll let you know when this little arrow is pointing at the full, or this one is actually almost empty. So you always want to double check before you take a patient upstairs or downstairs that their tank is actually full. Okay, so every tank has a knob, so I'm going to take this out so you guys can get a better visual. There's a knob here, so you could always check the wall in each room. They're connected to this, and it'll let you know how much of oxygen they're taking in. So we pretty much, you rotate the knob. So let's say the patient is connected to 4, so you just want to make sure you're actually matching the wall mount. There's an oxygen what is it called, connection, and you want to match it with being number 4. Alright, so the patient will end up being, they're going to be connected to this, and then we pretty much are going to come here, and we're going to connect the tip to this part here. And then just make sure, either if you're confused, you don't know what level, just ask your nurse. And then pretty much, let's choose number 4. We'll make sure we'll put it there, okay? And then when we go upstairs in the room, in each room you'll see an oxygen connection adapter there in the wall. And you're actually gonna match up to your number 4 here from the tank to the wall. Okay, so always you have any concerns or anything like that, make sure you talk to your nurse to see at what level the patient has, okay?
All right, so if you are connecting the patient to your wall-mounted oxygen, say you're doing a long procedure, their tank is low, or you're just a walk-in and they have their own personal tank, you want to be nice and hook them up to the hospital's oxygen. So you take the end that was hooked up to either the one in the bed, the one in their room, whatever the case is, and you're going to put that on and make sure it's super snug onto the connection, okay, so it doesn't pop off. And then you've already checked their level. Let's say the patient came in, they were on a 4 level of oxygen. You're going to turn it on. It says on to the left, so I'm going to turn to the left. This little bubble or ball starts to flow, and you go up to the level, put the ball in the middle of wherever they were at. Okay, so that would be a level 4 oxygen. Remember, always when the patient leaves, turn it off, because obviously you can't hear the oxygen flowing because it's going through the tubing. Make sure you always turn it off. Alright, here is the vitals monitor, and it's not hooked up to a patient right now, so you're not going to see anything. But what you do hear is you hear an alarm. It means that it's not getting a reading. You'll come into a patient's room for whatever reason to pick them up, drop them back off. When you hook them back up, you'll probably hear something like this in your experience. So Belay's going to show you that you can actually silence that alarm by pressing.
Basically, there you can press the pause alarm.
The pause the alarm.
And then we silence it. Pretty much the noise will stop, and then we could just leave it like that.
Okay, the silence is kind of like a temporary pause on the noise that you're going to get. It's gonna, if there is something that's off or whatever, then the alarm will go off again. Okay, so let's say we're picking up a patient and they are hooked up to leads, ECG leads, oxygen or ox pulse leads, blood pressure cuff. First thing you have to do is you have to actually pause the monitor, okay? Because if you don't, you take everything off, your alarms are going to go off. So go ahead and press the monitor standby. It's right there. You press that and you'll see that the monitor goes into pause. Okay, let's say real quick that you didn't see the monitor standby button. Well, there's this little arrow right here that you can press to change your screens until you get to the standby, and that's the one that just says, hey, pause all my monitoring. Okay, so we pause the monitoring, and now we want to detach our patient. Alright, so patients that you encounter are going to have leads on. monitoring their heart rate. And so
some are different. Some actually just, you press this little side button and it will actually attach to the actual sticky part. So there's the right side. You will put this on the right. And sometimes they have different colors. Sometimes it says RA. And then I was taught that there's black and red, right? So they say it's smoke over fire. So this one, you would normally put it on the side, right here, lower part of the abdomen. And then this one, which is a smoke, the black one, will be on top of the fire one, the red.
And when you come to a patient, they should already have them on. So you're just going to be taking them off if your site allows. Make sure you check on your site if they're allowing it, and then replacing them. You're not going to put them on for the first time. Sometimes with your leads, if you don't want to take them off the patient, but you need to transport the patient, they can't be connected to the monitor, so you can actually disconnect the power source from the side. So you just pull and then replace. Super simple. It just means that long cord of leads would hang from the patient, but that's what you do. All right, sometimes you'll also have patients that have blood pressure cuffs, okay? And so two things, you can either remove it with the little clips here, you pinch, and then release. Then the patient comes with their cuff, you just hang it up on the little hooks there or wherever your hospital has. Or if you notice that the cuff is falling, not really properly placed, you could just take the whole entire cuff off, leave it connected to the wire, and then when you get back to the room, always remember to return the patient exactly how you found them. So if they had the cuff on, they get the cuff put back on. And obviously you would connect it as well. Okay, by
just placing it back here.
Yeah.
It will clip on. You're gonna hear a little snap or click.
All right. All right, so this is the pulse ox monitor. It monitors the oxygen intake, and so we have to leave this behind when we take a patient. So you go ahead and pinch the ends, take it off the patient, hang it up on the hooks of the monitor box, or place it on a countertop. Do not put it on the floor. And then when you return the patient, go ahead and place it back on the finger it was already on. And a good way to remember is there's a picture of a finger on the top. If yours does not have that, pay attention to when you're taking it off a patient. Those little flaps hang down for ours. Just if you don't know, ask. Just like fire, burning up the way. All right, here's our CI Ron. That's Mike.
That's me.
Hey guys, this is Hannah. Hi. This is Sonia.
Hey.
This is Howard.
And this is Christy. This is Carrie.
Hello, how are you guys?
Okay. This is Brandon. This is Kim.
Hey guys, this is Anthony.
Hi.
Hey guys, and this is Jasmine. Oh, sorry.
Toma. 100. Acción. Take 100.
It will be your Trendelenburg position. It's pretty hard trying to pronounce that. For me, that is. Trendelenburg, Trendelenburg, Trendelenburg. Fowler's Trendelenburg. Yes, I think I there.
To avoid this,
I won't cuss, sorry.
Particular bed, all you have to do. Forget which way. I'm not even recording myself. I can't do it. All you simply do is wind the other way. No, this way. Is it working? Wait. Oh my gosh.
Probably heavy, that's
Guys. Fat.
Oh, wow. I think you get a workout out of it. Harvey. It's Trendelenburg. No. Trendelenburg.
Green, go. Red, stop. Green guy.
I'm so strong in my leg because I pump so hard.
With a dame, I shit it drunk, you came and get it on. 45 over your bank and get it on. Roll up like that thing.
Done. Trendelenburg. Trendelenburg.